used an interesting word before. You said the word impulsivity. And the minute I heard that, someone who's impulsive, can be devastating in a classroom. This is not behavior that classrooms are able to deal with very well if a child is impulsive.
Oh, the poor teachers. And as a social worker, I've been a social worker for 30 years, and I've been in the field most of that time, so I've had plenty of experience with children who have been not diagnosed, but they do have the symptomology of the prenatally exposed to alcohol children. And I've seen them in the classroom, and it's very difficult for the other students and for the teacher who is trying to deal with these behaviors and not really understanding why this child is acting this way.
So what help is out there for our educational system, for individual teachers, classrooms, and individual schools to help work with these children?
Well, first we need to educate our teachers about the fetal alcohol spectrum disorders and how the issues with the central nervous system with regard to physical and behavioral difficulties impacts these children, what kinds of behaviors to look for in the classroom, and also to help them come up with creative ways and tasks to deal with these issues. Now, these children have a real difficulty with fluorescent lights because of the buzzing sound. They have a hyper sensitivity to the sound of the lights. They really have difficulty with a lot of stimuli, and often in the classrooms there's tons of stimulus there with pictures, and they have difficulty making choices. So you might tell them to go to the library and pick a book while they're going into a library filled with all these books, when really they need to have a choice of maybe 3.
This is so interesting because so much of what you're describing, some of the symptoms you're describing, a lot of people use it to describe attention deficit disorder.
They absolutely do.
Are there children who have been diagnosed with attention deficit disorder who really, the cause is really fetal alcohol syndrome or fetal alcohol effect?
Well, we theorize that, yes, absolutely, there have been. And one of the interesting findings there is that some of the medications that have been or prescribed for those attention deficit disorder children don't work with the children who have the fetal alcohol spectrum disorders.
What do you do in cases like that? Because so many children now are on these very powerful stimulants to ostensibly treat attention deficit disorder, are doctors aware that they should also investigate the possibility of fetal alcohol effect?
I'm sure doctors are aware of that. However, doctors are hesitant to diagnose that, fetal alcohol effects, fetal alcohol spectrum disorders, fetal alcohol syndrome, because there's not enough known with regard to our evidence-based research for them to make this diagnosis, especially with the effects.
I wonder if it could also be the stigma too, especially, you're dealing with a concerned parent now, and I know some doctors, I would imagine, would be even hesitant to question the mother about her drinking habits when she was pregnant with the child who's been designated as a problem.
Well, that has been a finding, that doctors are hesitant to ask the pregnant mother about their drinking patterns.
So even during pregnancy, let alone afterwards, even during pregnancy they're hesitant to talk about drinking habits with mothers.
Absolutely.
This is a serious problem in the medical community.
It's a huge problem in the medical community because children are being misdiagnosed, and then we lack the curriculum, the communication with the teachers, with the parents, with the foster parents, to help them with these interventions. And often these children end up in and out of foster care because if you think about it, a mother who is drinking during pregnancy quite often will not stop drinking after the pregnancy. So you're going to run into these issues.
So it's not the most stable family to begin with.
Right. And as a social worker, we work in concentric circles. We're systems theorists. So we look at the family dynamic. And often these children are removed from the home, not only because of what is going on in the home, but their issues in the community of lying, robbing, stealing, getting in trouble in school, fighting. So they're removed from the home, placed in foster homes, and you know, the children that are prenatally exposed to alcohol have tremendous issues with transitions to begin with. So, you know, when they're transitioned in and out of foster homes, they have to change schools. I mean, all this is just totally confusing to them, although they do thrive on chaos because that's how they feel normal. Because they've been raised in that environment, and intrinsically they enjoy that chaos.
Does the foster care system pay special attention to this problem, since so many of these children do end up in foster care?
I think they're beginning to, because there is more education out there. I know with my own classes, I teach a child welfare curriculum for Ohio University within the confines of the University Partnership Program, where we have a BASW program, and also the students are prepared to go to work in child welfare. So we discuss these issues and these interventions. So it's systemically within the system, it's beginning to change.
Do you work with doctors at all? We had talked last week about how doctors don't talk. They should be talking to young women and young men before, when they're of reproductive age, but when they're young, about not abusing alcohol, about the effect of alcohol on the fetus. Do you work with doctors to make that part of their medical routine when they're talking to patients?
No, I don't do that personally.
Does anyone?
Well, actually, I know of one pediatrician, not an obstetrician, but a pediatrician down in the area that I live, who is very interested in this subject. So hopefully she is, working toward that, but I don't personally work with doctors on that.
It seems like this should be a part of national public health prevention. This should be a routine part of all doctors' protocol, that when they're talking to young women and young men, they discuss the effect of fetal alcohol syndrome and the effect of alcohol on a fetus.
Well, I know there are grants from the National Institutes of Health that are specifically focused on that, to develop curriculum, to talk to doctors and parents, teachers. I believe we have one called Double Arc in Toledo that is actually working in that direction.
I believe since the 1980s too that all alcohol bottles contain a warning, don't they?
Yes, they contain a warning.
I mean, who reads the label on alcohol? Right. It's not like that's had a huge effect, but that's been one of the principal means of trying to educate the public and prevent fetal alcohol syndrome.
And also the television ads. And as I speak of television, I would like to make sure that our viewers understand that these children are highly susceptible to television and to video games, have difficulty with the abstract thinking. They're very concrete thinkers, so often they'll watch a great deal of violence on television, believing that the person they might shoot someone and they'll get back up, and that it's not actual reality. So this is very dangerous. These children have a sort of a primal instinct for power, so that makes them very interested in gang-related activities.
And again, this is because of the way their brain has been structured because of the in utero exposure to alcohol.
Well, we really have to think of these children as brain damaged. I mean, growth and development occurs with them the same as it does with the quote-unquote normal child, although you're going to see differences in how they respond to conversation, to social interaction, and also because they have such difficulty in school with their behaviors usually.